causes vibrating feeling in the vagina. Occasionally, people have a buzzing, tingling, or vibrating sensation in and around the vagina. And of course, this feeling may come and go, and it can range in intensity. It may be a mild irritation or a painful spasm, but in most cases, the vibrating sensation is not a cause for concern. But feeling a slight unexpected vibration in the vagina can be a typical experience which can happen to anybody. And of course, there are several benign causes, things that are just normal that cause the benign causes. And causes of a vibrating sensation can be pelvic floor dysfunction. The pelvic floor is a muscle and ligament that connect the pelvic bone to the base of the spine. So what does it do? It supports the various organs and structures, including our rectum, our bladder, especially in females. And the pelvic floor muscles also support our uterus, they surround the vagina. And when we're talking about the pelvic floor, it's something we call pelvic floor dysfunction. It describes a decrease in the control of the muscles of the pelvic floor. And when that happens, people with this condition may have a weak or tight pelvic muscles. And when that happens, the pelvic floor dysfunction can cause various symptoms. You understand? And of course, this can include muscle spasm. When the pelvic floor has muscle spasm, it may feel like a vibration, within the vagina area. And of course, other potential symptoms of pelvic dysfunction might include increased frequency of urination, painful urination, incomplete bladder emptying. It might be constipation, might be painful bowel movement. And of course, at times, it might be unexplained pain in the lower back, genitals, or the rectum. It might be pain during or after sex, after sexual stimulation, or intercourse issue with the pelvic floor, which are particularly common after pregnancy and childbirth. And of course, we have something we call muscle spasm. A muscle spasm is a sudden or involuntary contraction of one or more muscles at the same time, involuntary. There's something that you don't have control over. And when muscle spasm occurs, they may cause a vibrating sensation. Note that the following factor may cause or contribute to muscle spasm. Number one is anxiety. Number two is stress. Number three is fatigue, when you are tired, overtired. Nutritional deficiencies. And muscle spasm can also occur as a reaction to certain drugs like caffeine. You understand? We most of us are guilty. However, they can be symptomatic of an underlying neurological condition. That is why we don't joke with it. So in this case, additional symptoms may also be present. And these additional symptoms may include muscle weakness, muscle atrophy, numbness or tingling sensation around the area, an abnormal gait, difficulties with his speech or swallowing, a whole lot of things. And some medication too can cause that, like Adderall. We have a whole lot of that. Then there's something we call vaginismus, a condition that involves spasm of the pelvic muscles around the vagina area, vaginismus. And this one can cause pain at the vagina opening. And it generally happens when someone is trying to place something, especially inside the vagina. You understand? Maybe you want to insert your tampon, you want to insert something, maybe drug, antifungal tablet. Therefore, anyone with vaginismus may experience pain during pelvic examinations, sexual intercourse, or when inserting a tampon. Then I want you to know that researchers as of now, they have not gotten to the root of this to know the exact cause of vaginismus. But it may be related to previous pain or discomfort from any of the following. Number one, inserting a tampon for the very first time. Of course, a pelvic examination, a sexual assault. When do you need to consult your doctor? Number one, you should be able to consult your doctor If the vibrating sensation in and around the vagina become frequent, more intense, more painful, then you may also inform your doctor if the sensation are alongside other symptoms such as what we call dyspareunia, that is pain during intercourse, or from inserting a tampon, pain during your urination, blood in your urine, unusual vaginal discharge, pain in the pelvic region, or unusual bleeding from the vagina. And of course, when we're talking about the symptoms above could point to an underlying condition. So it's not something to just wave with just an hand, just as a vaginal yeast infection, urinary tract infection, then of course it's sexually transmitted infection. So don't joke with yourself. You have any vaginal smells, any pain around the vagina area, please, or vibration, go see your doctor. See